in my role as consultant microbiologist for the GHA, I come over on a quarterly basis anyway, but this particular visit has been to focus on our laboratory preparation and analytical testing for SARS-2, which is the virus that causes COVID-19, across the full range of facilities here in the GHA, both the hospital testing, diagnostic testing here at St Bernard's, and the screening testing which is happening at the university lab up at the university campus.
So can you explain how the LAMP test works and how it's being used at the university laboratory for population screening?
Okay, yeah, the LAMP test is a different form of PCR, which is a mechanism to find the RNA, the viral code of SARS-2. So there are two general methods of doing it. One is by conventional PCR, which is for diagnosis, we use here at St Bernard's, and then the LAMP testing is one which we're using for rapid identification of the viral RNA to identify those in the community who may be carrying viral RNA and are therefore either infected or about to get infected, or maybe are infected in an asymptomatic fashion. The benefit of LAMP is that it is, one, it's highly specific, so positives are true positives, and it is also much quicker than conventional PCR. Conventional PCR requires multiple cycles of heating and cooling, whereas LAMP requires just one temperature, which makes it a much shorter test.
Is it any more or less reliable than the conventional test?
It is. We've found in our evaluation work at Hampshire Hospitals in the UK, where we have helped develop the LAMP assay together with Optigene, the company who produced the reagents and materials. We found it, when it's performed on RNA, to be equivalent to the real-time PCR testing. When it's used direct from a swab, which means it can be done without a prior extraction step, there is a slight trade-off in sensitivity, but it performs very well at picking up all the high-level shedding patients, so those who are likely to be transmitters of infection, which makes it very suitable for a population screening exercise because of that characteristic, and most importantly because of the speed of the test, which means that you can identify cases very quickly and then trace their contacts within a very short space of time.
And when it comes to a population the size of Gibraltar with its own particular unique challenges, how important is this particular test when looking at the medium to long term of living alongside the virus?
Sure, it's really important to have a rapid test for the benefits of finding your cases, those in the community who are either actively infecting or shedding virus, identifying them, asking them to isolate, and then rapidly tracking their contacts. Any delay in that process increases your number of individuals in the community who are shedding virus, and then that will then serve to further increase transmission of virus in the community, hence the RO number. So the aim is, with this rapid testing, is to bring that down. Now that testing program and the whole contact tracing program requires an extensive team. It will require an extensive team, both at one level to collect the swabs, then the administration around organisation of the swabs going to the right laboratory, the testing in the laboratory, and then identifying your cases, identifying your contacts, and acting accordingly. And that is something that I think is very important that Gibraltar has to build in over the next 6, 12, maybe even 18 months, because I think COVID, as a disease, is going to be, we acknowledge it won't suddenly disappear, and we need to make sure we have the infrastructure in place for such a team going forwards in that medium term at least.